Meet Mila, a patient recovering from a major surgery. Today, her doctor is going to introduce her to a life-changing medication, Heparin.
Good morning, Mila. I see you're up and well, and it seems like looking at your chart, you're recovering super well from your surgery. Because of it, however, you're just getting finished with it, we are going to be prescribing you on heparin. Do you know what heparin is?
No, what's heparin?
So heparin is an anticoagulant, and most people know it as a blood thinner. It is a type of medication that falls under that category. It helps prevent some medical emergencies such as strokes, deep vein thrombosis, pulmonary embolisms, and some heart attacks may even be caused by the formation of blood clots. So putting you on this medication is just going to reduce the risk of that. And it's recommended after surgeries or after a prolonged period of time where you're not moving much.
Heparin comes in two forms, one that is derived from animals and the other, which is synthetic, called low molecular weight heparin. This is the more common form of heparin, and its effects are more controlled and better understood. It's typically given as a subcutaneous injection or intravenously.
Is it safe?
That is a good question. Heparin is generally considered safe, but like any medication, it does have potential side effects and risks.
Side effects may include bleeding, bruising, changes in menstrual cycles, headaches, hematuria, dizziness, nausea, vomiting, and muscle pain. Rare but serious reactions like hemorrhaging, heparin-induced thrombocytopenia, and allergic reactions can also occur. Call your doctor if you experience excessive bruising, active bleeding, or signs of an allergic reaction like rash or swelling.
So what should I be aware of while taking heparin?
We're just going to be keeping an eye out for any unusual bleeding or bruising. You should also avoid certain over-the-counter medications like you might buy at the pharmacy, like aspirin and Benadryl. That's an anti-inflammatory that we just want to make sure you're not taking while you're on this medication.
Well, what would be considered unusual bleeding or bruising?
That would be any kind of bleeding or bruising that's more frequent, it may last longer than normal, or if you experience a large amount of blood loss. And this may include bleeding from your gums, and you might experience heavier nosebleeds. Some other things to be aware of while you're on heparin is if you get a cut on your finger or anywhere else, it may take a little longer to heal. If you're experiencing any periods, they may be a little longer, they might be a little heavier than normal. And you may also notice some blood in your urine, or you might have a black tarry stool. And please contact us immediately if you experience any of those symptoms.
Well, that sounds scary. Are there any other serious side effects I should be aware of?
One severe side effect we want to make sure you're aware of is a condition known as heparin-induced thrombocytopenia. That's also known as HIT. HIT is a pretty serious condition involving multiple blood clots forming and your platelet levels dropping. If we notice any symptoms relating to HIT or any other severe adverse effects, we'll stop you off heparin immediately. Thankfully, the effects of heparin last in the body only around 1 to 2 hours, so stopping it can relieve a lot of your side effects. But please contact your provider if you experience anything. And an antidote, if necessary, is protamine, which we can also administer if that becomes necessary.
Heparin therapy requires careful monitoring. Your dosage is based upon your weight. Your doctor will check your platelet count and APTT levels to ensure your dose is just right for you.
Well, I'm glad that you'll be monitoring me and that heparin can help reduce my risk for blood clots, but are there any people who can't take heparin?
Yes, there are. Some patients who have a history of HIT, if they have uncontrolled bleeding, or if they have very low platelet counts, shouldn't be on heparin. It's also recommended to not be taking heparin for certain procedures, such as an epidural catheter. But don't worry, we looked into you, and we know heparin is right for you.
Remember, heparin is here to help when you are at risk of blood clots. Whether you're recovering from surgery, dealing with atrial fibrillation, or taking precautions during long travel, heparin can make a big difference. Ask your doctor if heparin is right for you, because preventing clots today could protect your tomorrow.
Use as directed, not suitable for all patients. Consult your healthcare provider. Side effects may include bleeding, bruising, heparin-induced thrombocytopenia, and even death. If you experience any of these severe reactions, seek medical attention immediately.